Now, your health, your safety. This is ABC7 News.
I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 o'clock to get answers for you in real time with regard to coronavirus. But we want to start a little differently today because I want to begin by showing you where we stand in the Bay Area in terms of cases. So my colleague, producer Ken Miguel, built this graph that we're going to show you. It's really great in that it tracks COVID-19 spread over the past month, county by county, each county in a different color line there. You can see it all started around the beginning of March, and then March 16th there is when we had the shelter in place. And then you see all the lines going up from there. Purple is Santa Clara County. That's what we're tracking right there. Now San Francisco in that light aqua. And then you have other counties as well, San Mateo in orange, and you have Alameda County in the darker blue. But you can see we're still on that upward trajectory in basically all the counties. But I want to point to just the last couple of days. For example, let's take Santa Clara. Let's go to the purple one in Santa Clara, and my producer is manipulating this. They haven't reported the numbers yet for today, so it looks flat there. But even if you just look at the past few days, it looks like the climb is just a little less steep, or at least I'm hoping that's what it's suggesting. And I'm hoping that it's suggesting that our growth is a little flatter in some of the counties. And of course, we need more data. We need somebody who can make sense of the data. So joining us today is Dr. George Rutherford. He is at UCSF as head of disease and global epidemiology. Welcome, Dr. Rutherford.
Thanks very much.
Really glad to have you. I've been trying to get you on for a couple of weeks because you've been at this for a long time. You've worked for the CDC, helped San Francisco set up an HIV/AIDS research program back in the 80s. You've been the state's epidemiologist and health officer. Now you're working with local public health agencies on decisions related to COVID-19. So I want to start with this. Are we near the top of the curve here in the Bay Area?
Yes, I think so. I mean, we've had very encouraging signs. If you look at rather than looking at the data cumulatively, look at the numbers of cases per day, and it looks plenty flat. That's not to say that's not to say we can stop doing what we're doing and go out and celebrate. We got a long way to go to get out of this, but we're doing the right thing, and people are absolutely doing the right thing and need to be congratulated.
Absolutely. I mean, not only did we peak a little lower, hopefully, than we had hoped, but we flattened the curve, as you said. All of that has me wondering, when we do get to the peak, and hopefully that is soon, do we have enough, as it looks now, enough hospital beds, ICU, ventilators? How do we look?
Absent some spectacular misoccurrence, like a big outbreak among the homeless or in a nursing home, the answer is yes. We have adequate stuff, supplies, people, beds, ventilators, ICU space. We seem to have gotten. We seem to be, if not at the top, at the apex, but very close to the apex, and we're managing with what we have right now.
All right, that is great news. I'm glad, and I'm sure all our viewers are just feeling a little sense of relief hearing you say that. We're going to break some news right here because I've just learned that you guys at UCSF, you're part of a brand new effort with the city of San Francisco to do the kind of contact tracing that we've seen in some other countries, such as in Asia and Taiwan. And I've heard that this is really what we need to do in phase 2. So talk about this exciting partnership. What does it mean? Does it mean interviewing every patient?
Yes, absolutely. So we have a long-standing partnership with the Department of Public Health, and at least in my group, the Venn diagram is almost completely overlapping, and they help us and we help them all the time. So this is just an extension of that. Mm-hmm. We're helping the city put together they already had one, but a much more robust, much better staffed contact tracing system. So what would happen, for instance, Kristen, if you were to unfortunately get COVID-19 and were diagnosed, somebody from the city would talk to you and ask you about your contacts, people with whom you'd been in contact over the last few days. We have very specific periods of time we're interested in because we know when you are most likely infected and when you are most likely infectious, contagious, that is. And so if you were at home and it's staying at home, it's just your household contacts. If you're coming to work and it does have to look like you're at work, and maybe some of your coworkers that you would have come in contact with. We would offer those people testing, and if they were positive, they would get you would get isolated. If they were positive, they would get isolated, and if they're negative, depending on how close the contact was, which is both a matter of time as well as distance, they could potentially be quarantined for 2 weeks as well.
Mm-hmm. Now,
So this is the traditional way of dealing with these kinds of viruses.
Right. We've seen Taiwan, for example, do that fairly successfully. But when you do find those additional people, right, and you ask them to quarantine, would that be voluntary, or are we talking about also having the kind of technology, apps that would physically prevent them from, going out, and maybe the government will get an alert if they do try to go out and when they shouldn't be? Is that next?
I think that's it's sort of like ankle bracelets and home arrest. No, we're not quite there yet.
Okay.
The health officers in California have the authority to compel to mandate quarantine and mandate isolation. We're relying on a voluntary system now. Some of the stuff from East Asia is fascinating. So in Singapore, if you're in isolation or in quarantine, your phone pings and you have to take a picture of where you are and send it in within 3 minutes, or else you get some giant fine. And by giant fines, I mean like $2,500. I mean, big fines.
I mean, that kind of thing could be in the debate for us, right? In discussion.
Yeah, I mean, that's a little overly coercive, but, we would, and right now we're not having problems with people who are isolating or quarantining. But the exception is that people who live with roommates, right? And they're in a single room, some flat, and they may not have the physical space to quarantine. And so for that reason, or they're homeless. So the city has some hotel space that it's rented that can accommodate people who are in isolation. It's really designed for the homeless, but you can imagine other scenarios where people are, have 3 roommates in one room or something, where you'd really want to get them out of that.
Yeah. Dr. Rutherford, I'm really excited to hear about this contact tracing, but that sounds very labor intensive. Who's going to actually do all that work?
So it takes a ton of labor. So we've had a number of people from UCSF who've volunteered to come help the city. Again, we have a longstanding partnership. So the city has its own investigators. We've added people to make phone calls, to encourage people to come in for testing, to track them, to make sure they come in for testing, record their results, all those sorts of things. We're having a second round of training this weekend, and some of the people who are going to be helping us going forward are medical students, the city librarians, and some of the people from the city attorney's office, which I think is quite remarkable. It's great to have their participation. This really is consisting of phone calls, texting, that kind of stuff. We'll leave the knocking on doors to the people who do it for a living, but right now, this is a big expansion of the labor pool to do, as you say, it's something very labor intensive. Yeah, it's labor intensive, but it's better than everybody staying inside, having to stay inside.
Absolutely. I want to ask you, about 2 to 3 weeks ago, you were quoted in the press saying predictions that 70 to 80% of Americans will get the coronavirus. Wildly high. Do you still think that's wildly high?
Oh, totally. Yeah.
What do you think the actual numbers might be?
2%, 3%, something like that. In Italy, it's 4%. In Wuhan, in China, the big city, it's maybe 2%. So it's not, I mean, if you're talking about over the next century, okay, maybe. But certainly from this first phase, this first wave we're dealing with,
right.
I would be surprised if we have more than 1% of the population of San Francisco infected.
All right. Well, what do you think about the numbers that even the CDC, they were citing a week ago, maybe 200,000 Americans may die based on the latest data and what you're seeing and saying now? Will that number, you think, be lower too, much lower?
So, yeah, no. So you have to realize that we're really different than the rest of the country. I mean, it's finally come to pass. I mean, we're really, really different, and that's a function of shelter in place. Having gone to shelter in place early, which took incredible political courage on behalf of the mayor and all the boards of supervisors, and also the mayor of Berkeley, because it has its own health department. This is going to be legendary in public health if we can really pull this off. And so far we are. That's what the difference is. And you'll recall that we went to shelter in place on March 16th. That's no accident. It avoided St. Patrick's Day, right? Which is a big mixing event. You saw what happened in New Orleans.
Yes.
Because of all the mixing during Mardi Gras.
Right.
So that was no accident that happened that way.
Yeah, I mean, I continue to be amazed that about 5 weeks ago we were at the same number as New York, and now New York is more than 10 times greater than what we have here, and we certainly feel for our friends in New York. But as you said, we've taken the actions here that needed to be taken. All right, Dr. Rutherford, don't go away because we're going to take a short break on the air, but let's continue this conversation over on our live stream. So you can join us on Facebook Live, YouTube Live, on the ABC7 News app or ABC7News.com right now.
And we're in commercial break.
All right, Dr. Rutherford, we have a couple of viewer questions on Facebook Live right now, which I want to
very disorienting looking at the side of your head, but that's okay. I understand.
Okay. Oh, I see what you're saying. Right. Yeah, we'll have to consider moving this monitor for the future. You are actually.
It's okay. It's okay. I can. You know, the side of your head's perfectly attractive.
Oh, thank you. That's very kind of you. Somebody asked about hydroxychloroquine, and at a hospital, how did they decide who gets it? So I think it's worth asking about that, and also whether hydroxychloroquine has even been proven. I know it's being prescribed by some, but has it been proven to be effective? You know, in treating COVID-19?
Yes, I'm happy to answer that question. The answer is no.
Not proven. Okay, but it is being prescribed.
It is being used in sort of an experiment as an experimental drug. At least that's how it should be being used.
Along with other drugs that are also considered
with other
experimental.
drugs. Yeah, there's a big antiretroviral called remdesivir that's being used.
So then how?
Antiviral.
So, for example, at your hospital, how do people decide who gets what?
So to start with, well, we have a lot of protocols in place, sort of trial protocols to understand, to experiment with these drugs to understand whether they really work or not. These trials are called randomized control trials. They're the sort of definitive proof whether something actually does more good than harm. The deal with hydroxychloroquine, though, and I would really like to bring this out, is that there are a number of indications for it that have already been proven for fairly rare diseases like with lupus and rheumatoid arthritis. And to the extent this drug's being cannibalized because of this rumor that it works.
Dr. Rutherford, hang on to that thought because we're coming back on air, so we'll resume our conversation back on TV.
6, 5,
Sure.
4, 3.
All right, we are back with Dr. George Rutherford, a professor of epidemiology at UCSF with tons of experience in infectious diseases and now working alongside the city of San Francisco to figure out the best way forward. I wanted to talk a little bit about, our shelter in place and social distancing. Obviously, that is to buy time for the development of a vaccine, of truly effective treatments. What is happening on those fronts?
There are any number of drugs in trials. So let's talk about drugs first. There are any number of therapeutic drugs that are in trial to treat not only the viral infection, but also to treat the acute respiratory distress syndrome. That as you tip over in clinically, that's what kills people. And it's this inflammatory storm that's a consequence of the pneumonia. So there's two different things going on. So in terms of the antivirals, I think everybody's heard about hydroxychloroquine, or chloroquine itself, which are both being used and being tested. We're also testing an antiviral drug called remdesivir, which is a broad spectrum antiviral that was originally developed for Ebola. So we have these things in trial. The hydroxychloroquine has been hyped a lot. And it's the chances that it works are, well, maybe it does. We certainly hope it does. But understand that it's far from proven. However, there are proven indications for hydroxychloroquine for things like lupus and lupus nephritis, the kidney disease associated with lupus, rheumatoid arthritis. And to the extent people are running out and buying up the world's supply of hydroxychloroquine, patients who really need this drug, for whom the indications have been actually proven, are having a hard time getting it. And that's I think that's a real tragedy.
Yeah, I mean, I hope everybody takes that message to heart, including doctors and pharmacists, right, who have access. I want to ask you, though, as people start to get cabin fever, people are asking, when do you think we can start resuming our, I don't want to say normal life, because I know once we restart, it won't be truly normal as it used to be. But how long do you think before we can start relaxing some of these measures?
Well, we're going to have to replace them with something. And the contact tracing we discussed earlier is one of the main bulwarks of what we're going to replace it with. There will also be some other things in place. We'll probably have to continue to wear masks outdoors. We'll probably also continue to restrict large gatherings of people. We'll probably, it's kind of like we probably may ask people who are over 65 to continue to stay home mostly and to not go out and socially mix as much as they may want. Just to get us over this hump. So as I said, I've said this before, it's like a three-game football playoff series, and we're just in the start of the third quarter of the first game.
So it sounds
we'll be out of this part by early summer, late spring.
Okay.
Then we have a long period of time, maybe as much as a year, 10 months, 9 months, of the next phase, which is temporizing until vaccine gets here. So that's going to be with contact tracing. That's going to be with a mask. That's going to be with some sheltering in place. That's going to be with decreasing restaurant and bar, crowding, those kinds of things. We need to figure out a way to get schools going again quickly. I know cabin fever, having a 5 and a 3-year-old at home is not helping your cabin fever, I'm sure. And those are the things that that's going to be what's going to come down in the next phase. And then the third phase is getting everybody vaccinated.
Right. And we hope that'll be within a year, something like that.
So if there's one thing you can learn, there's one thing everybody should walk away with is that whatever Dr. Fauci says is absolutely true. And if he says 12 to 18 months, that's what it means, is 12 to 18 months. Now, he said that a month ago. Yeah. So he could say 11 to 17 months.
You know what? Maybe this is wishful thinking, but could COVID-19, be something that kind of drops off in the summertime with warmer, more humid weather? Some people have certainly been in prominent positions that pointed to that possibility. But is there any data looking at, for example, other countries where it is warm right now that would happen?
So it's circulating in the southern hemisphere. There have been large outbreaks in Brazil. So I wouldn't be taking that one to the bank. There's also an outbreak in China in a sauna, in a steam room. So, it seems rather unlikely. Now, there may be some because people get outside and there's some social distancing from being outside and not cooped up. And influenza does drop down in the summer, but that's probably because kids get outside and get out of schools. So if you're going to see an effect, it's going to be very small.
Is it possible that a lot of us have gotten over it, and now have immunity, but that we just don't know about it yet?
I think I would not say a lot. I would say some. We think that the prevalence in the city is at the end of this is going to be sort of on the level of 1 or 2%. So that means, there might be 8,000, 10,000, 12,000 people who are immune at the end of the day, at the end of this wave of the epidemic. And so in the sense of absolute numbers, it seems like a lot, but as a percentage, it's actually quite small. We're getting antibody tests online. That's going to help us differentiate and sort that out. But it's if you're thinking of being able to, for instance, say, let's have all the kids, who have antibody go back to school earlier. Yep. That's not going to be very many. That's not going to really be a solution.
Right. I was thinking about the workers, too, especially the essential ones. All right. Dr. Rutherford, that is all the time we have today, but I can't tell you how excited I am to hear about your efforts to do contact tracing on a widespread basis. I know it's a lot of effort, but I know that data is absolutely critical. So thank you so much, and we invite you back anytime to share more information as you learn more.
Thanks a million, Kristen.
Thank you. All right, we have a lot left for you today, including special correspondent Dr. Alok Patel's take on when this may all be over. But the live streams never take a break, so join us right now.
And we're in commercial break.
All right. Do we have time to chat again with Dr. Rutherford, or no? We don't. Okay, thank you very much. I appreciate it. Wow, that was the most intellectual fun I've had like this whole week. So thank you, thank you. I learned so much from it. If I ever go back to medical school, I've got to take your class. Take care. Talk soon.
Good to see you. Take care. Bye-bye.
Bye-bye. All right, folks. Wow. I feel like that was, for me, an eye-opening conversation. I hope you feel the same way. I really appreciate Dr. Rutherford taking the time to chat with us and share with us what they're doing with the city of San Francisco right now to kind of take on that type of absolutely critical, almost detective work, to find out, you know, who everybody that's tested positive, who they came in contact with, and who did those people come in contact with, keep them contained, keep them quarantined, right? And just really try to bottle it up and keep it from spreading. That was done fairly effectively in some smaller countries in Asia, especially Taiwan being one of them. And he also talked about technology that could be on the horizon to better track people without really invading your privacy, juggling those demands. And then, of course, the vaccine coming 12 to 18 months from now. But in the meantime, we have to keep up with what we're doing. You know, the takeaway is not, you know, we peaked, so we're good now, let's go out and party. That is not the case. And keep in mind that the curve can change anytime when behavior changes. What you see today is absolutely based on our behavior over the last couple of weeks. So, all right, we're going to go back on air on ABC7 News. My director is asking me to scooch a little bit so we can see this wonderful graphic with Dr. Alok Patel. All right, coming back on air.
6, 5, 4, 3.
And we're back. We're able to bring you even more content now that we have this new platform at 3 every day. That means we get a daily doctor's note from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts, and every day he's going to talk directly to you about a topic regarding COVID-19. This one is our topic of the day.
Let's talk about how we're going to reopen society on today's COVID-19 doctor's note. Now, some parts of the country are seeing a slowing of cases while others are bracing for a surge. We're not ready to get back to normal. Normal might still be a while away. The American Enterprise Institute released a roadmap on how we're going to reopen society after this pandemic. It's broken down into 4 phases. Phase 1 is where we're at right now, and that's slowing the spread. That's physical distancing, calling for more testing, making sure our hospitals have the right supplies to not hit a max capacity. Before we get to phase 2, the reopening phase, we need to make sure we can test everyone and monitor all active cases. We have to make sure our hospitals are adequately staffed and have no shortages. At this point, some schools, universities, and businesses may start to reopen, but the same physical distancing will probably still apply. The public will still probably be using masks, and we're all gonna follow the same hygiene guidelines. Also at this point, high-risk individuals may still be asked to stay at home. Phase 3 is when we can really start to lift restrictions. But before we can get there, we have to have a vaccine. We need therapeutics. We gotta make sure we can build immunity against the virus. We gotta make sure we can treat and protect those high-risk individuals. After all this, there's obviously a phase 4, and that's preparing and preventing the next pandemic. That's using lessons from this one to build a better plan. Now, this roadmap may sound daunting and like a really long process, but it's the best way to ensure we prevent a rebound in cases while we start to get the economy back up and running. Hang in there. For now, you know what to do. You're already doing it. Stay home.
We are doing it. All right, we'll be back on air in just a moment, but the live stream continues right now.
We are in commercial break.
All right, folks. Can I scooch back now? All right, I just want to read some of our Facebook friends' comments and see what y'all have been saying watching the program. Let's see. I still see people not wearing a mask, says Jenny Wu. Right, we should for our own protection and the protection of others in case we are affected but asymptomatic. So there are some cities in California that are levying a fine now if they catch you not wearing face covering. I don't want to say mask because that implies that it has to be you know, a surgical mask or N95 mask. It could just be a scarf. It could just be some sort of face covering. You can make your own. Resources are out there in terms of tutorials on how to make one. So we can all do it, and we should all do it. Let's see, what else? Let's see, we are in phase 1, yep. Why is employers telling workers not to wear a mask? That is not right. Well, if your employer is telling you not to wear one, I would certainly think that you have the law on your side to insist on wearing one. So I'm not sure who you're referring to, but I will tell you that I've been following the journey of Dr. Vernon Huang on the U.S. floating hospital, the Navy floating hospital Mercy, and even they started all wearing masks a couple of days ago at the recommendation of the CDC, even though that really realistically they've been in close contact with 1,000 people on board for the last 2 to 3 weeks. But they're still doing that, and we should follow suit, absolutely. All right, checking out some of your other comments. Madeline Alvarado says, good job, girl. I enjoy the watch. Well, I appreciate that. I enjoy chatting with you every day at this time. All right.
9,
We are coming back on air, folks.
7, 6, 5, 4, 3.
In partnership with Feeding America, GMA is staging a Day of Hope today to share food resources and show you how to do that with our viewers. So I tweeted this out when I volunteered at the Alameda County Community Food Bank and San Francisco Marin Food Bank. I did that a couple years ago. During this crisis, there's definitely a growing number of people who don't have access to nutritious food. So joining me to talk about this is Paul Ash, the executive director for SF Marin Food Bank. Actually, that's where I think my photo was taken. Paul, thank you so much for joining us.
Well, glad to be here, and thanks for the good thoughts.
Absolutely. Now, I learned when I volunteered at the food banks that if people donate $1, you can stretch that to $7 worth of food. Is that still the case? And why should people donate now?
Well, we still have leverage, but as this crisis goes along, we're losing some of that leverage. And the reason behind that is generally with the flow of food we've had in the past, we've been able to get a really strong mix of donated food in there. We are having to move so fast now that we're actually having to go out on the market and purchase some of our food. So it's not quite as good as it was before, but you're still getting a multiple on your dollar when you donate to food banks.
I mean, obviously, we've reported on a lot of people losing their jobs, but Paul, there are also kids who, you know, they don't go to school, and I know the school districts locally are really good about still providing the lunches, but can you talk about it from the kids to the seniors, what the need is right now with this pandemic?
You know, we're all shaken up as a society. The things that we were doing 4 weeks ago really no longer work. You mentioned kids. We had pantries, weekly pantries, where we distributed groceries at 45 schools. On one day in March, that ceased. Now, fortunately, some of those schools opened back up programs to provide bags of school lunches for kids. And so kids and their families had a reason to come back to the schools. So we threw some of our pantries back up in those locations. So we continue to connect with those families. Seniors, another highly impacted group. Because many of them, when they first heard that there was a state of emergency and then the shelter-in-place order, realized that they probably shouldn't be going out to the pantry that they were getting weekly bag of groceries. So since then, we've been standing up a program to try to get deliveries of that bag of food back to those individuals in their homes, using volunteers like Amazon to help us pack that food in advance instead of farmers market style, and then delivering it right to their door.
Paul, we're out of time, but I just want to get a yes or no on this. The best way to help right now is, yes, to donate money, right? You don't want people dropping off cans, you know, at the food bank. You just want the monetary donation, yes?
That is a big yes. There's lots of reasons that cans can't help us right now.
Yeah, absolutely. Posh, great work. Thank you so much for sharing that message. And whether you need help getting food or looking for ways to give back to your community, go to feedingamerica.org. Feedingamerica.org. The website shows you where to find food, plus volunteer opportunities just by entering your zip code. Again, that doesn't have to be done in person. Got to respect social distancing. You can also make a donation and trust that all funds will go to a Feeding America food bank right here in the Bay Area. And that's going to do it for now. Thanks so much for joining us for today's interactive show, Getting Answers. We'll be here for you every day at 3 o'clock on air and on live stream, answering all your questions. World News Tonight is coming up next. Thanks for joining us.
We are clear.
Thank you. Thanks, Paul. That was wonderful. I appreciate it.